2, 3.
Hi, I'm Dr. Shel. Today I'd like to talk a little bit about something interesting, exciting, and perhaps a little embarrassing for some of you, but I think it's something that needs to be discussed. And that is female libido, as well as male libido, but today we're going to focus on female libido and a treatment that I find very exciting, very interesting, and it has helped so many of my patients that it's just been a life changer for them. It's called O-shot. O standing for, yes, orgasm. The reason it's a very interesting procedure is because a lot of women, as they age, and even some younger women that we've noticed, have issues with sexual satisfaction, with their sex drive, with their libido, and it's one of those topics that are not very comfortable to discuss for most practitioners. So what happens is they end up suffering for years and never get a resolution to it, and furthermore just don't know what to do about it and internalize it, which then causes them to have emotional toxicity in the relationship as well as just with themselves. So the O-shot, scientifically speaking, is a procedure in which we draw the patient's own blood, we spin it down, and we extract the platelet-rich plasma. Most of you by now have heard of PRP. We use PRP for many things in our practice, whether it's facial skin rejuvenation, hair restoration, and now also with the O-shot. And this PRP is something that has over 10 different growth factors, but they're your own growth factors that are going to be very well received, and there's going to be no antigenic issues or any allergic issues or anything. So what we do with this is we extract this PRP, which is again platelet-rich plasma, and we take it and then inject it after numbing, of course, so don't worry about the pain, it's quite pain-free, and we inject it around the clitoral head and as well as in the anterior vaginal area. So those two areas are super important for you to have sensation, for you to have satisfaction, for you to have even some tightening because you're developing that collagen over there. Most of my patients who've had the O-shot done feel that everything has changed, everything is improved, and their partners notice that the woman is just enjoying sex much more. And with that, the relationship flourishes. And with that, it's really important that the two people come together in a different fashion. So if you want to know more information about the O-shot, just go to drshel.com, that's drshel.com, and you can certainly learn much more information about the O-shot. It's safe, it's very effective, and it's very affordable. So there you go. There is some great information about the O-shot. That is something that I would like to mention once more. It is different than the G-shot. The G-shot is essentially a hyaluronic acid, like something similar to Juvederm, Restylane. Those are HAs that we place around the G-spot so that most women, after a certain point, really don't even know what that G-spot is. And it is in the anterior vaginal wall about a third of the way in. So what we do is we measure everything and we look at where the G-spot is by examining the area, the patient examines the area, and we put the G-shot there. So those two are different kinds of treatments, and so we select our patients very carefully depending on what their concerns are. So thank you for joining me today, and if you need more information, just like I said, go to drshel.com and we'll be happy to help you in any way.